Kevin in Bozeman is back. Kevin, are you there?
Yeah, hey, Aaron, sorry about that. I'm working and I lost the signal for a second.
No worries. I know how it goes.
I'll be quick. I just wanted to make two quick comments. One is I wanted to thank your doctor for that answered and question that lefty called in and tried to trip him up on. I'm going to steal that, too, because I get a lot of people who are like, oh, don't you care about people, and isn't it a right to have health care? So I thought that was an excellent answer that you gave to him. And secondly, Medicare for all is just Medicaid, and I don't need to get too political on this, but Medicare they're trying all single payer into calling it Medicare because people like Medicare and they paid into it their entire life and they want to see it come back to them in their elderly years. But that's the whole point. You can't have Medicare for all if you haven't paid into it your whole life. Then it's just the government paying for it, and that's the problem with our health care is that everyone wants someone else to pay for it, and those our friends on the left just don't really want to deal with the issue of bringing the cost of health care down so people can afford health care instead of making someone else pay for it. And that's, I think, what our country, the direction we need to do. So anyways, I just wanted to throw those two comments out.
Yeah, great. Hey, great. Appreciate that follow-up there, Kevin. Thanks for your call. And I would add, just on behalf of our previous caller, I don't know if our previous caller was left or right, because it could have even been a conservative, Tina, that good question there, too. But either way, great thoughts there. From your perspective, I think Kevin said something interesting there, and I think he might have mentioned that a while back, too, which is very intriguing, which is it really Medicare for all, or is this more like Medicaid for all? How do you interpret that as a doctor?
Yeah, it's a really good question, and I think what it gets down to is cost, right? And the caller made a really good point, Kevin did, that if you're not paying into the system and you're just asking for healthcare benefits, then that is a little bit more similar to the Medicaid program. Medicaid was set up for the indigent and for those who didn't have means to provide for themselves, and it was really a safety net for those folks. And if all of a sudden you expand that to everybody, you're basically saying, okay, everybody, you can just have healthcare coverage, but you don't need to pay in for it. And we know that doesn't work. And I think it's important as people listen to the political discussion around, single payer system or Medicare for all or catchphrase, a lot of times we label it. But what they really focus on is you as a healthcare consumer, when you need healthcare, don't you want it? So vote for me. And that's really the premise of a lot of that. And what you really need to think about is, okay, if I'm going to go access healthcare, that's going to cost a certain amount of money. Who is going to pay for that? Is it the government's going to pay for it? Does the government really pay for anything? Like, we are the government, right?
Yeah,
the people.
Even the insurance company.
We pay into it. You pay
a
premium to Blue Cross Blue Shield. You pay a premium to United. Even on Medicare Advantage plans, you're paying a premium, and you pay into that system. So you get what you pay for. And so what I'm saying is, if it's a single payer system and no one is discussing how much is going to be paid or what the covered services are, I think you need to look at it a little skeptically and think, okay, I'm going to get what I pay for. If nobody's paying for it, I'm probably not going to get very much. And so then maybe this is just a platform I'm running on. So people really need to think about who is going to pay for it. How are they going to pay for it? How is that going to come back and get me? Because you're going to pay for it one way or the other. Either through taxes or premiums or something.
If your doctor is telling you, look, you really do not need this pill or this X-ray or this whatever, that's their way of saying, hey, you don't need it. But also, that's their way of also trying to keep healthcare costs down for whoever is paying for it, one way or the other. We got another caller on the line, Gay Ann in Browning, listening to KSEN. You're on with Dr. Scott Sears from St. Vincent Healthcare. Thanks for your call. Gay Ann, are you there?
Oh, yes.
Yeah, thanks for your call. What did you have a question or comment for the doc here?
Yes, I'd like to ask him if it's possible for a spouse to feel their spouse's pain, and has he ever heard of it?
Interesting. Yeah, interesting question. So, is it possible for a spouse to feel, kind of a spiritual question in a way almost here too, but is it possible for a spouse to feel the other spouse's pain? Now, I know we've joked about how us men are big wimps. Guys are big wimps, and my wife will explain something. I'm like, stop telling me about it. You know what I mean? So I can feel the pain when she describes it to me, but kind of a spiritual question, I guess, there more than anything. Huh?
Yeah, and I think there's not a lot of research on this other than twins. So there is some research on twins, and so identical twins or fraternal twins, interestingly, there does seem to be a little bit more of a connection between them. If you talk to any siblings, sisters in particular, who tend to talk more about emotions and feelings than perhaps brothers do, who tend to beat each other up, at least in our house with 4 boys, there is a connection. And oftentimes people do sense, like it's not uncommon for me to talk to somebody who says, my sister called me and said, hey, I'm worried about you because I was feeling this. Are you feeling that? And they do. We don't have good scientific reasons for that, but I would say absolutely we hear of it. We know it occurs in twins and in very close siblings. And if spouses are close enough to each other, I imagine that can occur. But I don't have a good scientific answer for why it would occur.
Well, not to joke too much, but, we've got a dog and a cat, and I'm more of a dog guy than a cat guy, but I always get nervous when the cat wants to sit on my lap. I'm like, what are you doing, cat? You don't even like me, and you're sitting on my lap. I'm worried because, they have the animals that will sit on the laps of people just before they die, and I'm like, am I going to die? Why is this stinking cat sitting on my lap right now?
Maybe they're just attracted to you. But it's a good question, and I think there's probably something there that you can feel pain, and there's also deep empathy. And the more you care about someone, the more you have empathy. And there actually are studies in the brain that you will have on a functional MRI. You can have a certain part of your brain light up in response to a close loved one's pain. And it's a very similar part of the brain that's lighting up in their functional MRI. They haven't gone beyond that to explain how that occurs, but it definitely is showing up on some of these functional MRIs.
The brain is such an amazing thing that we probably only haven't even really truly begun to understand yet, too, that everything that's involved there. All right, let's see. The phone number for you, 406-294-0970. Real quick, a lot of the questions you've been getting from friends or others, digestive issues, whether it's irritable bowel syndrome, gastric bypass. So you're getting a lot of digestive type questions.
Yeah, and I think it's interesting. As we get older, it's a common joke as patients get older that they tend to focus more and more on their bowels. But it's true in all of us. I think people are focused on their digestive issues because it impacts our life. And for those of you that don't believe that, just wait till 2 hours after you gorge yourself on Thanksgiving and you can listen to your bowel tell you how much it's going to control your life. A lot of people had questions around, my doctor says I have irritable bowel syndrome, but I don't know what that means. I think that's just a hoax. How do they know I don't have celiac sprue, gluten sensitivity, Crohn's disease, dumping syndrome, lactose intolerance, all these things? Don't you have tests for this, or am I just allergic to things? Let me just very briefly say irritable bowel syndrome is just a label that means you have a functional bowel disorder. We split things into functional bowel disorders and structural disorders. Structural means you have a mass, you have a cancer, you have an inflammatory ulcer, you have something structurally in your bowel that's causing symptoms. Functional bowel means you are feeling symptoms that are caused by your bowel. And structurally, it looks normal, which basically means it's not functioning normally. Either it's not digesting the food appropriately, or it's squeezing and contracting when it shouldn't be, or it isn't squeezing and contracting when it should be, and thus you're constipated. So people can get diarrhea if it's overactive. They can get constipation if it's underactive. They can have just pain in their gut if 2 parts of their gut are squeezing at the same time and pushing against each other. That's what we call irritable bowel. We can distinguish it from all these other disorders because we have tests for the other disorders. Colonoscopy will look to see if there's anything structural in there. We have a blood test that we can do that looks whether or not you truly have celiac sprue. Lactose intolerance is as simple as if you eat lactose, you get symptoms 100% of the time. It's not like I drank milk today and I was fine and tomorrow I didn't, so maybe I'm lactose intolerant. It's any lactose causes you problems. And so there are things that we can do.
So it's an at-home test if you want to look at it that way.
And irritable bowel syndrome is a functional disorder. We tend to treat it symptomatically. We know we can't cure it, but we can treat it symptomatically depending on what your symptoms are. So there are things that it's worthwhile going to talk to your doctor about if you have irritable bowel that we can help with those symptoms.
Before we go to this next break, I'm going to sneak in another caller question here, and then we'll chew on it during the break, and then get the answer. Jim in Big Timber, did you have a question or comment?
Yes, I was wondering why you can't, when you go into the doctor and you have a procedure, let's say carpal tunnel surgery, okay, or scoping your knee, you say, well, okay, I want to have this done. What's it going to cost me?
Price transparency. Great question from Jim in Big Timber there. Hey, when I go to the doctor, how come I can't just say, well, all right, you want me to get this done? Well, how much is that going to cost me? Dr. Sears, your thoughts?
Yeah, great question. This is all the buzzword about price transparency. So the gist is, if you go in and you're what we call a self-pay patient, meaning I'm going to pay cash for this procedure, your hospital or provider should be able to tell you this is exactly how much we're going to charge you, cash pay up front.
So if they don't tell you...
If they don't tell you, it gets complicated. And this is why our healthcare system is so complicated. It goes back to Medicaid, Medicare, everything, single payer system, is because the price that a hospital charges has nothing to do with what they get reimbursed. And so for a patient to come in and say, hey, how much does it cost to get my knee scoped? A hospital may say it costs you $2,000. That has nothing to do with a hospital gets paid. Because if you have Medicare, Medicare has already negotiated and said, we don't care that it costs you $2,000, we're only paying you $1,200. And so, and by law, the hospital can't charge Medicare $1,200 and the patient the other $800. Blue Cross may have a negotiated rate with the hospital for that same procedure. They will pay $2,800. And the patient has a copay of 20%, or your plan, you may have a copay of 10%. And so depending on what your payer is, what your copay is, what your deductible has been met, it gets extraordinarily complicated for one hospital who is dealing with hundreds of payers.
But there are
to
more
come
efforts,
up with,
bottom line, there are more efforts being
price.
made both at the federal level and through individual hospitals to be more price transparent. And if you pay with cash, there's additional incentives often.
Almost every hospital or doctor can give you a cash price, and it is always discounted compared to what they're charging, just because of the way our healthcare system works. But you should be able to go in and they can talk to your insurance, and if there's enough time to prior authorize it, they should be able to tell you exactly what your payment's going to be.
All right, a quick question from Fred in Great Falls, or comment from Fred in Kalispell. Fred in Kalispell, did you have a quick question or comment for the doc?
Yeah, good morning. I just went 2 days with diarrhea. You're talking about digestion, but anyway, I'm all right now. But the reason I call is Medicare. They think Medicare is free. It costs me, between me and my wife, I'm 79 years old, $6,000 a year. But, the Medicare, they take it out of your Medicare payment, and also have to carry a supplement, and that runs into a lot of money. So I end up paying $6,000 a year. But I'm also pushing for the last 10 years, I've been pushing for tort reform in the state of Montana. And it's in the state of Texas, you sue, you lose, you pay all court costs. In Montana, you can sue, and nothing happens.
All right, good question. Tort reform, is that something
the cost of healthcare, probably it depends on the estimates. 10 to 20% of the cost of healthcare comes down to malpractice. Now, the biggest thing is physicians. It has been shown in multiple studies, physicians over order certain tests and studies because they're literally afraid of getting sued. In fact, if you talk to a physician and say, why did you order that MRI? It's because I was afraid I was going to miss something and get sued. That's called defensive medicine, and it's been shown time and time again to increase the cost of healthcare. So tort reform is really important. We do need medical malpractice. We do need to hold people accountable when they're making poor decisions when it comes to people's lives. We also need to have reason. They can't just sue over everything. And I like the idea of a frivolous lawsuit. The person is on the line to pay for it.
All right. A couple minutes left, so we're speeding through it here to try to sneak in as many phone calls as we can. Marie in Great Falls, did you have a quick question or comment?
Hi there. Yes, Dr. Sears. I'm going to start at the end and go back to the beginning. I have chronic pain in my upper right abdomen. It is localized in an area where I had laparoscopic surgery to remove my gallbladder 9 years ago. I had pain after the operation, took antibiotics, it cleared up, it shows up periodically, and heat, like a heating pad, helps. I do drink. I don't know that I drink excessively, but I've been watching a show that says every doctor believes that every patient lies. So I guess you can take it from there.
So in the interest of time, because we're almost out of time, is it basically that pain that won't go away? Is that kind of your question there?
Well, I'm wondering if I need to actually, because it'll go away, I need to know if I need to actually go get it checked out, or could it possibly have come from some scar tissue or something?
All right, good question. We got to hold it right there, unfortunately, due to time. Yeah, Dr. Sears, your thoughts?
Great question. Right upper quadrant pain in the abdomen is very tricky. We had a lot of nerves there. I think it would be worthwhile meeting with your physician at least once, which you probably have. What's interesting to remember is that I have patients who are missing both their legs and they still have foot pain. And so there are a lot of things going on in pain that have to do with nerve signals to the brain that have nothing to do with your abdomen. You may not have anything wrong with the right upper quadrant of your abdomen, but your brain is perceiving that the pain is there. There are some great things. If you tune in 2 weeks, we'll talk more about the mind-body techniques that can really help some of that pain. It is always worthwhile going in at least once, getting a general look over. It's pretty easy to do some very simple screening labs, maybe even an ultrasound, proving there's nothing structurally wrong, and then going down the road of what can we do to alleviate that pain so you can be functional.
Dr. Scott Sears, always a pleasure. Thanks for joining us. Dr. Scott Sears with St. Vincent Healthcare. And, hey, they're doing some incredible stuff with video appointments at all of the SCL Health hospitals from Miles City to Butte, you name it. So that's interesting stuff. And they're expanding to Bozeman and Lewistown. Just hired a doctor in Lewistown.
We have docs hired in both places, and all of our docs are going live with video visits in December.